experiencing homelessness have equitable access to healthcare?
Healthcare access is one of my particular passions. So, as a former street nurse, supporting people through, particularly in their day-to-day primary healthcare needs, is very much my concern. Now, the challenge that comes up is kind of multifactorial when we think about access to health services, and so the issues are kind of system wide and different. So within primary care, which is like your family physicians, your nurse practitioners, what often happens is that people become disaffiliated with their care provider. And that can be in kind of multiple directions. That could be being fired by your family doctor, for example, because of a substance use issue. That could be because people move, they with transients, that they are changing cities or changing neighborhoods, so they become disconnected that way. And so there's a disconnection from that kind of foundation of primary care. At the same time, there's poor access in other ways into the system. And so they've done so many studies on barriers to access of healthcare for people experiencing homelessness. Always the number one identified issue is poor experiences with healthcare providers. So that's the number one barrier, is that they've gone somewhere, they've had a terrible experience, they were treated badly, prejudicial experiences, and so they are avoiding unless necessary access to those. And that we see that most often in emergency rooms, for example, secondarily in clinics. So they lose the foundation of their primary care provider, they have poor experiences in other areas of the system. And then what ends up happening, and I've been guilty of this as a street nurse, is that they get really episodic care. And so we put in place some stopgaps like community health centers, adding a nurse into a emergency shelter. And there's no connection, there's no foundation, so that one day they're at a walking clinic, another day they see this nurse here, and the next day there's a nurse practitioner at the soup kitchen they talk to. And so there's no stability of care. And so in the context of medications, you see people on and off medications with no kind of planning or connection around that, particularly around mental health care. We see people diagnosed with 7 different things over 7 years. And so it's kind of this, like I said at the start, it's multifactorial in that there's disconnection, there's discrimination, and then there's this patchwork that people receive. And so ultimately, what we need to do is we need to reconnect people with a stable foundation of primary health care.
Mm-hmm. Makes me think of the care that we do in brigades going into third world countries, and we drop in and and do a brigade and for a bit and then pull out, and there's no connection.